Good afternoon and welcome to another St. Clair County Daily Briefing. Today I'm joined with Director Herb Simmons of the Emergency Management Agency and Director Barb Holt of the St. Clair County Health Department. Barb, you have today's numbers and we're still struggling a little bit here.
We are. Things are not looking, they're looking good St. Clair County-wise, but they're not looking very good regional-wise. Our regional percentage rates keep going 8 and above. So we continue to try to stress the need to make sure people wear their mask. It is so important because nobody wants to move back to phase 3. And if we keep moving this direction, we'll be restricted even more to try to prevent this disease. So today in St. Clair County, we have 69 new positive cases of COVID for a total, this was 69 out of 1,035 that were tested. That's a positivity rate of 6.7% in St. Clair County. These positives ranged less than 10 years of age up into their 80s. Fortunately, we didn't have any deaths today in St. Clair County. So overall, St. Clair County, we've tested 49,772 with 44,977 negative and a total of 4,795 positive with a total of 160 deaths. Today, statewide, the state showed an increase of 1,828 folks that were positive, with unfortunately 5 more deaths in the state of Illinois. And again, that makes state of Illinois' total 7,726 deaths. Our numbers were lower for these for a while, but again, it seems to be picking up. So this is real, folks. It's here. It affects all ages, and we just have to. And we're probably going to sound crabby today because we feel like we're preaching the same thing every single day of people need to wear their masks. People need to do this. This is so important and it's so simple. It's so simple to wear your mask, to protect yourself, to protect someone else, to protect your loved ones. In our congregate living facilities, we have 2 additional cases at 4 fountains with a total of 107 cases and 27 deaths. And at Mercy Rehab and Care Center in Swansea, we have 1 additional case for a total of 8 cases, but no deaths. As far as testing goes, we have several test sites coming up next week. Next Monday, we'll be in Shiloh, a drive-through clinic from 8 to 4 at their community park. On Tuesday, we will be at Belleville West High School in the back of the schoolyard, also from 8 to 4. This too is a drive-through. And then Friday, we'll be at Moody Park, 8 to 4, as a drive-through as well. So again, these test sites are posted on our website as well as the EMA website. And with that, I will turn it over to Director Herb Simmons. How are you, Herbie?
Grouchy.
I told you, so am I. I'm crabby too. This has got to stop.
Well, it's let me give the zip code reports. Chairman Kern is not here today. He's out making some plans because these numbers over the next couple of days are probably not going to be in our favor, and so the powers to be are going to have to be making decisions, and so I will fill in for his zip code report today, and then we're going to discuss just a little bit. 62059 stays the same at 10. 62201 stays the same at 200. 62203 increases by 2 to 167. 62204 goes up by 2 to 124. 62205 stays the same at 67. 62206 goes down 1 to 367. 62207 goes up 2 to 219. 62208 goes up 8 to 310. 62220 goes up 2 to 385. 62221 goes up 9 to 440. 62223 goes up 5 to 248. 62225 stays the same at 19. 62226 goes up 15 to 502. 62232 goes up 1 to 109. 62239 goes up 3 to 60. 62240 stays the same at 19. 62243 goes up 1 to 37. 62254 goes up 1 to 146. 62255 stays the same at 13. 62257 stays the same at 26. 62258 goes up 5 to 84. 62260 goes up 6 to 81. 62264 stays the same at 72. 62269 goes up 12 to 358. And 62285 goes up 1 to 48. Now, I don't know, Barb and Brian, it's everywhere, every zip code. Basically, some of them's increased by 12, some by 9. And again, when I preach about this, I'm not preaching to the Team St. Clair members who are out there helping us. Our staff reads your messages. We know you're sharing it with your friends and families, but just since we've been in here today, we received 3 calls, complaints of businesses. Barb was on the phone as she walked in, taking a complaint about an establishment. People, you're getting, for those of you who aren't following what we've been preaching, you're going to get what you want. As I told you yesterday, pat yourself on the back, be proud, because you are going to be the ones that's going to be sending us to Tier 1 and then probably Tier 2 by next week.
I think it's important to mention that we've had a lot of questions come up here recently about the going back to Phase 3, and I think it's important. It's not really going back to Phase 3 at this point.
Right.
There is 3 tiers of Phase 4 for additional metrics that can help slow this.
Right.
And hopefully we wouldn't get to the point of going through those 3 tiers and having to go all the way back into a full Phase 3, but
Right.
if we don't get better, it could.
Well, and as the numbers, and Barb said it earlier, in the county, when you look at our positivity rate, we've been staying pretty well consistent.
We've been getting better overall. Yeah. We had really high rates, and we've been bringing it down by trying to get the education out and the testing out to the folks. But it's again, we're looked at as a region, so disease doesn't stop at county lines or even at the river or state lines, and it is everywhere. But people just need to come face it. Wearing a mask is not hard.
No,
it's not a big deal.
And I get tired of hearing about, well, it's just St. Clair County. No, we reported the other day Missouri tightened back up on some of their restrictions. They rolled back their seating capacity in their establishments. They closed their liquor establishments earlier.
Right.
So, folks, it's just not St. Clair County. It's just not Illinois. It's anywhere across the country.
Absolutely. Our surrounding counties within our region, their rates are going up. Again, our region is St. Clair, Madison, Bond, Clinton, Washington, Randolph, and Monroe, and their rates are going up as well. So it's everywhere. We just we're pleading, we're begging, we're trying to educate folks to please take heed, because no one wants to go backwards.
Well, and that's the thing. And Brian, you said that we see a lot of people commenting on there about the 7 days and then the 3 days. Can you explain to our viewers the difference and why we're watching those 3 days? Because we're over the 8%.
Correct. When you look at the regional numbers are a 7-day rolling positivity rate. So the state takes a look at 7 previous days of total positives divided by total amount tested in the entire region to come up with what that percentage is for that day. And then those numbers are announced on a 3-day delay. So like today, that regional positivity was 8.4%, but that was as of August 12th.
Right.
So we're 3 days behind. So tomorrow's number, if it is again over 8%, which we're feeling we could be, it is based on August 13th. So we could already be there.
Yeah, we could be at 8.5 by tomorrow, which that's what we're probably predicting it's going to be. And again, it's just everybody. I've said this for weeks and months now. It's just not one person. It's each and every one of us. And for those of you Team St. Clair members that are out there spreading the word to your family and friends, I just can't believe the people that, Barb, and I know you're faced with it every day. You hear it too. People just, it's nothing.
Right.
I mean, I don't know how you get through to them until it knocks on their door.
Exactly, and that's what we're seeing in a lot of folks, that, it's really not here until it affects their own family or some friends or something, that people realize that, oh my goodness, it is. And we've had folks that have dealt with COVID on the show in the past and the long-term effects it can have. Sure, there's several people that are asymptomatic, they have no symptoms, but they test positive, but who wants to take that chance?
Exactly.
Who wants to take that chance? No one.
I know 2 people that got their test results back yesterday as positive. I got 6 phone calls yesterday evening to contact people with them. So it went from 2 people testing positive, and then all of a sudden 6 people's calling and saying, I was with them, they're friends of mine. So that's how quick this thing can multiply.
Absolutely, and that's why we do the contact tracing, because again, those positive folks may not even known they were positive, and they're hanging around everybody and not wearing their mask. So they've been around 6 people. So now that 1 case turns into 7 that are out in the community.
Yeah.
And it can just happen that fast. I saw a little article over the noon news. John Mosielak was talking about the Cardinals, and he goes, as careful as you can be, and they were trying to do all the right things, he goes, you just don't realize how fast it can spread in a group. He said the Cardinals have seen it. I'm glad to see him finally playing today. Waino pitched great, and they won. But it's devastated them, and look at the precautions they were taking and how quickly it can spread.
Well, and then of course, we're dealing with all the conspiracy theories that this thing is going to be over with. It's the flu, it's the cold. Well, I mean, the last I was told, they give flu shots every year. We don't have a shot for this. We don't have a vaccine for this. So until we do, we're kind of stuck with it.
Absolutely.
They say, oh, well, more people die from the flu than dies from this. Do you want to be one of them? I don't. 160 of our county residents have passed away. And of course, then you have the conspiracy theories that say, well, yeah, but those 160 died, but they didn't die from the COVID. Well, they're not the coroner and they're not the medical experts. So don't pay no attention to those conspiracy theory people out there. I don't. I will respond to them if they want to be respectful. But, I think it's a slap in the face to our first responders also. The same people that when you get sick or when your loved ones get sick, you call the ambulance company and the paramedics and the EMTs have to come to your house. Do you think they want to come there dressed in their mask and all their precautions? You got to think about them. And then you go to the hospital. You have your nurses in there that's having to take all those precautions. And like I said the other day, the doctors that we've had on here, the physicians that have sit here and said, the mask is our best defense against this. Now, we'll listen to them when we go to the hospital or we take a loved one there and they say, well, yeah, they're having chest pains or having a cardiac problem. We'll listen to what they say then. But because they sit here and said, wear a mask for the little bit of time you're out there, it doesn't do any good. It's a slap in the face to all of our medical professions. And if I was them, I'll tell you, we've had paramedics on here. We've had the physicians. We've had the CEOs from the hospitals. Next week, we got 2 days of doctors coming back on to talk about the long-term effect of this virus. So, but again, I'm almost to the point where the good members that are out there, Team St. Clair, and the good citizens of the county that are really taking the warning, I applaud all of you. It's you people that think that you know it all, that you sit there and think that you're smarter than the doctors and the medical experts and the health department people. Well, I got a news for you. 8.5 tomorrow is what I'm saying we're probably going to go up to. It's 8.4 today. And it's all because people don't want to wear a mask and they don't want to wash their hands and they don't want to watch social distancing. So, Brian, that's my rant for today. You got anything else?
No, I mean, the numbers are what they are. They have already occurred. People are still being tested, and we need to continue being tested. But the only thing we can do at this point is follow those 3 W's, and that's the only thing that's going to help slow the spread of this. We know it's not going to eliminate it. It's not going to just following the 3 W's is not going to make this disappear. But it is definitely going to slow that spread, help with that contact tracing. And then the important part of that, and I know Barb and the health department have talked about this before, but if in the contact tracing, you need to be honest with those contact tracers so they can do a full assessment of who you've been around, and then people need to make sure they obey the quarantine or isolation order that they're given to make sure they're not out further spreading this, because as you said, it can go real quick.
Yeah, we're seeing that. So We'll be back here momentarily with Cindy and Daisy to translate this into the Spanish communities, and then we'll be back tomorrow afternoon with our question and answer session and a new set of numbers, and we'll see if we're still climbing. Have a good evening.